This is Dr. Ron Klatz for the American Academy of Anti-Aging Medicine. And today we are very honored, that's the word, honored, to have as our guest Dr. Kirby Hotchner of Miami, Florida. Dr. Hotchner is an amazing physician, and he is what could be called a classical osteopathic physician. I'll let him tell you more about that, but Dr. Hotchner and I go way back some 44 years. I had the great opportunity, the great privilege of being with Dr. Hotchner when I was in medical school. And we were in study class together. And frankly, if it wasn't for Dr. Hotchner's great intellect, I might not be here now. Brightest guys I know. He graduated first in my medical school class. The guy has an incredible capacity, and he has an inner wisdom and knowledge that goes far beyond the medical books. And hopefully he will share that with you now. But Carol Petersen, pharmacist, expert in compounding pharmacy, women's health issues, and hormonal replacement therapy. And we're going to bring you this interview with Dr. Kirby Hotchner, doctor of osteopathic medicine. And again, for Immortality Now, I'm Dr. Ron Klatz. This episode is sponsored by the American Academy of Anti-Aging Medicine. Dr. Hotchner, welcome to the show.
Thank you, Dr. Klatz. It's such a pleasure to be with you.
Okay, and we'll take from, and Dr. Kirby had the great and amazing and miraculous Dr. Kirby Hotchner.
Well, it's a pleasure to be with you here today to share. I can't claim that the wisdom I share is totally my own. It comes from within. It's the same wisdom we all have inside ourselves as we access truth, spirit within us, which has been guiding me always, even through medical school, through all the years guiding me, teaching me what to learn, bringing me new information, sharing, bringing patients to me, learning from everybody, from to all the people that have taught me along the way, the great professors we had in medical school, and pretty much everything every day is really a teaching experience to learn, right? But I would say in the last year or two, that rate of learning is accelerated, as the desire to help people on a deeper level gets greater, the information just shows up, with you. And I hope to be sharing some of that information today.
Well, Dr. Hotchner, Dr. Klatz, so perhaps a question, what started this interest in copper and subsequently iron, and where are we going with it? What's showing up in your practice with it?
I had a couple patients talk to me about this thing called the root cause protocol maybe 8 months ago, and I didn't know what it was. I'd never heard about it, and sort of put it on the back burner. But when things keep coming up, then I start taking a look at them. I heard an interview with Dr. Mercola back in, I believe it was March of this year, of Morley Robbins, who was the inventor of this protocol. I said, that sounds really interesting and really familiar. Let me look into it a little bit more. So as Ron knows, when I look into something, I really go deep down into the rabbit hole. So I really started studying everything I could from Morley, studying his podcast, everything on his website. I was so impressed that I actually decided to take the class, the training that he offers. I'm actually, we're in week 15 right now, of week 16 out of the class, and really taking a deep dive with Morley as we go deeper and deeper into what's actually known about copper and iron over the last 100 years or so from the medical literature. All the information we're actually talking about is actually in published, peer-reviewed medical information of the last 100 years, and not just one article, but oftentimes 10, dozen, 50, or 100 different articles from the top researchers in the world, all coming to pretty much to the same conclusions. The problem is that in medical school, all types of doctor training, we don't hear a word about this. We're taught very little, if any, about nutrition. Ron would probably agree with me that we probably never heard the word copper or ceruloplasmin in medical school. Did you ever hear about that, Ron, in medical school?
I think I heard it mentioned once in a biochemistry lecture, and that was the last I heard of it.
Never heard of it in pharmacy school either. Not a bit.
The only time we hear about it is in Wilson's disease.
Yes.
They mentioned ceruloplasmin.
Exactly.
but it's extremely rare. And that doesn't go into what the clinical research has shown about ceruloplasmin and copper. And I think, like many things that we know, the information has been suppressed so that both doctors and people don't find out the potential that some of these therapies can do in their healing. Right. And I think over the last 100 years, we've seen a systemic undermining of people's health purposely by the changes that have gone on in the environment that have affected copper and many other nutrients that are critical for our health.
Just for a second for the audience, maybe you could outline some of the ways that the food supply has been undermined. The way that, for example, iodine supplementation in bread has been replaced with bromine. IQs dropped accordingly.
So maybe we go back like to the end of the late 1800s when they started adding synthetic pesticides, arsenic pesticide to the soil, right?
Mhm.
And progressively since that time, we developed hundreds, if not thousands, of different chemicals that were adding to the soil, the water, and the air. In the 1980s, we developed the most potent one called glyphosate or Roundup. Well, it turns out that Roundup is a very powerful copper chelator. It chelates the copper out of the plants, out of the soil, and out of our body, all the way down to a pH of 1, right?
Wow.
Which most people don't know.
Compatible with life.
Incompatible with life. Incompatible with life. So starting in the 1900s, we started refining food. We started taking a lot of the healthy foods that our ancestors had eaten, and we started stripping all the nutrients out of it, stripping all the fiber out of it, and then adding back a few synthetic nutrients back to the food, right?
But today, what is the percentage of healthy nutrients in our minerals in our food compared with, back in the 1900s?
Let's just take copper, which we'll be talking more about. In the 1930s, if you go back in the medical literature and you look at the blood levels of what people had in the blood, the average level in a woman was around 170 and a man about 140. People are lucky if they have 80 or 90 these days. The average diet back then had 4 to 6 milligrams of copper in the food. Now 80% of people don't even get 9 milligrams of copper a day. That's just one nutrient, which is one of the most key nutrients, right? So we're on the 5th generation now, our kids that are copper depraved because the copper's not in the soil. And each generation is getting more and more copper deficient. So what's supposed to happen in the 3rd trimester of pregnancy, the mom is supposed to give a huge copper download to the baby, right? They have actually 3 copper proteins during pregnancy, right? And one of the main roles of that copper is to regulate iron metabolism in the form of an enzyme called ferroxidase. So if we don't have enough copper and enough ferroxidase in the placenta, what's going to happen is the child's going to be born with an overload of iron and not enough copper. So they're coming out as iron men, iron babies, right? The problem is that iron is extremely inflammatory. It reacts in the cells in the mitochondria with oxygen to produce ferrous oxide, which is rust. So we start rusting from the time we hit the ground, right? We're rusting when we don't have enough copper in the body, right? So copper we'll see in the bioavailable form, which is the ceruloplasmin we talked about, has very important roles in the body. It's like a Swiss Army knife. It has like 24 different forms, like a transformer. But I would say the 4 most important things: one, it has to manage oxygen that comes into the mitochondria and activate it to produce energy in our cells. In the mitochondria, we produce energy in the form of ATP, and we cannot produce that without ceruloplasmin. So what happens as we get older and we become more copper deficient, since it's not in our food, we can't activate that oxygen. The metabolism, which is the activation of oxygen, slows down. We get mitochondrial deficiency or delay, right? Now, when we burn energy to produce fuel, ATP, we produce exhaust, free radicals, oxygen free radicals. That process is called oxidation. Copper enzymes also have to deactivate the oxidants. And there's very famous copper enzymes you all heard of, like glutathione, smutase, catalase. Those are copper enzymes. So we can't manage the exhaust that's coming out. And when we're not making energy, guess what? We're making exhaust. So as we get older, we get more inflamed, we get more free radical damage, and the free radicals are building up in the tissues of our body, like hydrogen peroxide, hydroxyl, superoxide are building up in our body. Next, we have all these enzymes in the body that are copper dependent. A lot of them are called oxidases. The main one is the one I mentioned a moment ago, ferroxidase. Ferroxidase has to help move iron everywhere in the body and get it recycling. What happens when iron doesn't recycle is it gets stuck on the tissues and it builds up. And we accumulate about 1 milligram of iron every day of our life, 365 milligrams a year. So by the time you hit 40 or 50, you've got double-digit figures of iron trapped in the tissues, right? And this is what the regular doctors don't get. They see all these women that appear to be iron deficient in the blood when you measure their hemoglobin or serum iron or ferritin. And the issue is that it's all trapped in their tissues and it's not recycling due to the lack of copper, right?
There's a lot of women they're experiencing heavy bleeding during perimenopause and the doctors don't help them with that.
Yes.
So all of a sudden they feel less and less energy and they're going to go supplement their iron.
Exactly.
And
So the worst thing you can do for somebody who's got 20, 30,000 milligrams of iron trapped in their tissue is give them more iron, synthetic iron, which is what the doctors are doing. They're even giving women iron infusions, right? We need 1 milligram a day of iron from the diet. The other 24 milligrams is supposed to come from the iron recycling system in our own body, which is broken. So imagine what happens when you get 60 or 100 milligrams a day, or even 200 milligrams, what the doctors are doing. It's causing so much inflammation and cancer in people's body. Iron is what initiates and promotes the whole cancer pathway. So when we're not producing energy with oxygen, we're going down the glycolytic pathway, which is the cancer pathway, right? Which is why we have an epidemic of cancer. We started in the United States adding iron filings to the food in 1941. And we added 50% more in 1969. And that was based on a very small group of women who were said they were iron deficient. But get this, in 1929, two of the most famous scientists that ever lived in the world, Dr. Hans Krebs from the Krebs cycle, Otto Warburg, who won the Nobel Prize, did an experiment in animals on birds, two different kinds of birds. They bled them almost to death to the point where they were barely alive to create a true anemia, blood loss anemia. And they measured their enzymes. And guess what were the only enzymes that were increased in the liver? The copper enzymes. They proved that only in the extreme case of almost dying was the person that iron deficient, they were copper deficient. And in 1978, there was a really famous study by Dr. Hodges, an MD, 3-year study. He deprived patients of retinol, vitamin A, for 1 year, and their hemoglobin dropped. And then he gave them iron supplements. And for 6 weeks, it came up and went right back down. And it didn't go up again until he gave retinol. So what he proved is that retinol, vitamin A, is what regulates hemoglobin in the body. In 1850, Dr. Thompson in England was using cod liver oil, which is rich in vitamin A, to cure so-called iron deficiency anemia. 3 doctors, MDs, from top institutions won the Nobel Prize in Medicine, 1934, for using beef liver to cure iron deficiency anemia and pernicious anemia. Do you think any modern day doctors know that? Do you think they do, Ron?
Well, no, they don't, because the pharmaceutical companies are not detailing them on these issues. And if you suggest it, you might get a letter from your state licensing board suggesting that you're not following medicine according to established guidelines.
California.
There is a millennial of medical knowledge that we've accumulated that we've just, put in the closet and locked the door and kept it away from modern practitioners.
Exactly.
You're absolutely right. This technology has been there. It's been proven. It's been proven in thousands and thousands of patients, and it works. And the worst part of all for the powers that be is that it works so well, and it's non-toxic
and non-patentable.
And not patentable, so it's not going to be a cash
Not Luke.
about this. I wouldn't suggest that the powers that be are interested in money over it, but
No.
there are some who might suggest that. Not me.
So really what we do in the root cause protocol, first, we educate the patient of what they need to stop doing to lower their copper. Because we're all born with low copper, right? It gets worse as we get older, as we said, because it's not in the food. But there's a number of things that the pharmaceutical and the food industry has done to make it worse. So many of the prescription medications that people take on a routine basis are copper and magnesium chelators. For example, most of your antibiotics, your statins, metformin, diuretics, your proton pump inhibitors, birth control pills, right? So many of the things that people are taking to treat the symptoms of what's caused by copper ion dysregulation is making them worse, right? And then we have a bunch of actual synthetic nutrients, which many functional doctors and naturopaths are prescribing, especially since COVID started 2 years ago, which are destroying their immunometabolism, such as iron, number one, iron supplements, iron-rich food, right? Zinc. Zinc's another huge one that everybody's been pushing. And
Right.
zinc stimulates metallothionein in the liver, which is an important protein that binds 1,000 copper atoms for every zinc atom. So if you want to exhaust your copper supplies quickly, take zinc.
Viral.
Totally.
Mhm.
Copper is nature's antimicrobial. It kills viruses, parasites, bacteria, fungi, and it's been used for hundreds of years in the past, right? And that information has been suppressed. So iron feeds all the microorganisms of the body. They feast off them, they thrive off them, and copper kills them, right?
Well, I'm protected then. I have my handy dandy hand copper bracelet from
Well, it might help you a little bit, but that's not actually the bioavailable form of copper. That's inorganic copper.
this is not going to save me. Huh?
Sorry,
All right.
sorry, to disappoint you.
Oh well.
So that's another thing. Copper is antimicrobial. We said it recycles iron. It produces energy in the mitochondria. It activates all these enzymes, and it deactivates the oxidants. Those are a few pretty important things that are going on. So all the symptoms of disease and aging are caused by iron accumulation in the body, right? Do you think anybody's talking about that? Are you talking about that, Ron?
No, even with at the Academy of Anti-Aging Medicine, and we're focused on this more than any other medical group, certainly in America. It's not a big topic of discussion.
But it's not just people with
It's just-
hemolysis, which is a genetic disease of iron overload. It's every single person on the planet is getting iron overloaded. Why do you think we're seeing so many young people under 10 now with chronic degenerative diseases, neurodegenerative diseases, autism, learning disorders, ADHD, diabetes type 2, hypertension, cancer, adult diseases, Alzheimer's in the 30s now? Iron overload. Their brains
Herb?
are full of iron. Yes. So that's interesting that you bring that up. So in the iron overloaded liver, which has to detox the body, it cannot do that when it's full of iron. And then you introduce a vaccine or glyphosate or a medication, and it can't detox it. And these are precisely the people, young kids, that are getting the severe reactions. They're copper depleted, iron overloaded people, and you're introducing all these other toxic compounds into their body, and they can't handle it. They can't handle it. Who are all the people that died from COVID? The only people were the people that had obesity, metabolic syndrome, hypertension, diabetes, right? Those are iron overload symptoms.
Would that also apply to supposedly healthy young athletes dying mysteriously with cardiac arrests?
Well,
Or
I think there's two sides to the story to that. Many of these young athletes, particularly women, are
Mhm.
given iron, or they're
Wow.
given erythropoietin for doping. So you're putting oxygen or iron into a body that's copper deficient. And what do you think is going to happen? It's going to cause more oxidative stress. So I'm going to say it anyway. So Morley pulled up a couple studies from the medical research that the spike protein in the coronavirus and in the coronavirus vaccine is analogous to hepcidin. Now, most doctors don't know what that is, even though we learned it in medical school. Hepcidin. Hepcidin is an iron regulating protein, and the body secretes it when we have pathogens in the body to get the iron out of the blood so they don't feast off it, and it traps the iron in the blood. So if I was an evil genius and I wanted to create something that would cause serious damage to people, I would inject something in their body that was similar to hepcidin. All these people that are full of iron are now being stimulated with a hormone that's locking the iron deeper into their tissue. And do you think anybody's talking about that?
No.
No,
Oh,
they're talking about that. So why do you think all these young athletes that have been injected are all of a sudden dying on the field, right? They have too much iron to start with, and they're getting these injections, which are filling them up with more iron, and the iron is overloading their hearts, their blood vessels, their immune system, the different organs, and they don't have enough copper to manage it, right? So they're getting this new condition called, like the babies used to get the SIDS. Now the
Yeah.
adults are getting it. They're just keeling over, right? From a heart attack, from a stroke, right? But we've never seen that before until the last year and a half.
No, over 1,000 amateur athletes in the last year or so died suddenly.
But
Suddenly.
to my understanding, not a single one of a non-vaccinated athlete had that happen, nor has it ever happened in the past. I think it's a combination of these young people are so copper depleted, iron toxic, and then we're putting these toxic compounds in their body, and they can't handle it. They just can't handle it.
so will replenishing copper, so putting back copper, will that help you reduce the iron stores, help excretion?
So it's a combination of getting the iron recycling again by using bioavailable copper and retinol, as we saw the vitamin A, magnesium, which prevents the iron from rusting, maybe a couple of the nutrients. And then we have to chelate out or get rid of the high iron levels, either through phlebotomy or an iron chelator in the body, right? You have to get rid of that what's already built up because it's at such a high level. And there's only two ways of doing that, either through phlebotomy, bleeding the person, or through using certain iron chelators. And there's prescription iron chelators and there's natural iron chelators. But one way or the other, we have to get those higher levels down as we're working to get that iron recycling system working again. So that doesn't happen in the future. And we're avoiding the supplements that deplete copper and then increase iron absorption to the body. I didn't mention vitamin C. Everybody's been pushing C, especially IV vitamin C, liposomal vitamin C. That's the worst one on the list. Vitamin C blocks the copper 1 transporter, so the copper cannot get into the cells. It denatures the ceruloplasmin and it increases iron absorption, particularly in the gut, into the cells. So when you do that, and high dose vitamin C increases hydrogen peroxide, free radical, right? So yes, like chemotherapy, that might have an effect on the person, but what's it doing to the normal cells and our normal metabolism? And then we have vitamin D, and this is a really touchy point with everybody. Everybody's been pushing synthetic vitamin D, storage vitamin D, which is just a storage hormone in the liver, when they're not talking at all about the active form of vitamin D, which is throughout the literature, which is 125D, which is the only form that works on the vitamin D receptor with retinol to run the immune system. And vitamin D in the active form, you don't need to take that. The body produces it naturally when we have enough magnesium to get it metabolized out of the storage form. So when we take all that synthetic vitamin D, and this is in the literature,
in order to make that conversion happen?
You need magnesium to make that conversion happen. So sunshine vitamin D is totally different. That's sulfated, water-soluble vitamin D, which is safe, it's beneficial. It's not 25-hydroxy-D, which is fat-soluble, which is stored in the liver. It takes up to 4 years for that synthetic vitamin D to come out of your system. And all the clinical research shows it can take up to 4 years once you stop the synthetic vitamin D for it to come out of your liver. And the clinical studies show, research shows there's no clinical benefit in having a 25-hydroxy-D, which is what all the doctors are measuring over 21. Back a few years back, when you had a 12, 13, or 14 vitamin D, that was considered totally normal. till Dr. Fuller came around and changed the scales a few years back to make it 30 to 100. Right. So I think it's part of this evil agenda. Vitamin D is a steroid hormone. It has very powerful effects in the body. It actually suppresses our ability to absorb retinol, vitamin A. And retinol is critical for getting the copper to the ceruloplasmin. It calcifies our arteries. It blocks magnesium, because we need magnesium to metabolize the vitamin D. It decreases renal potassium, kidney potassium. We lose potassium in our kidneys when we take synthetic D. And guess what? It stimulates hepcidin, just like the spike protein. There are many studies have shown the synthetic vitamin D stimulates hepcidin, locks the iron, driving it deeper into your tissues. So the more synthetic vitamin D people take, the more they're causing dysregulated immunometabolism.
What about cod liver oil for both the A and D?
Cod liver oil is the richest natural source on the planet of retinol. And nature has the perfect ratio of retinol to vitamin D, which is 10 to 1. That vitamin D is in very small amounts, and it's in a natural form that the body can use. And that and sunshine vitamin D are the only ones people really need. So people don't really understand what the true purpose of vitamin D is. It's just a sunshine filter. It's like sunglasses, right? So the body naturally produces that. We're in the sun to protect us from UV radiation. And when we don't need it, the levels go down. We don't need the sunglasses. Vitamin A is the light sensor that in the sun, and this is the most important function of sunlight, that the retinol is converted to retinoids in the body, which are converted to nuclear receptors, which drive our immune system. Vitamin A, for 100 years, it's been known that it is the immune hormone. It runs the immune system, not vitamin D. And all the research up until recently has shown that for the last 100 years, and that's been suppressed.
So yeah, we've been demonizing it for a few decades now.
Now
What do you
vitamin A is
think?
toxic. With synthetic vitamin A, palmitate, synthetic vitamin A, but we're not talking about that. We're talking about natural vitamin D. So what happened in 1955 when President Eisenhower had his heart attacks? They created this whole cholesterol myth that fat was bad for you, that it caused heart disease. And they took all the healthy fats out of the diet, right? And they put in synthetic fats, right? Like Crisco and refined vegetable oils and trans fats, right? Which are highly oxidizable, react with oxygen, and heart disease took off through the roof, and cancer. And they took all the retinol out of the diet at that time. It went with all the healthy fats that our ancestors have been eating, like lard and butter and ghee and saturated fats and coconut oil. Those are natural, healthy fats that our ancestors have eaten from time immemorial, which kept them healthy. If you look at the largest study that was ever done on nutrition by Dr. Weston Price, who traveled around the world, right, and studied every single healthy group on the planet in the 1920s, he found that every single tribe that followed their native diet had high amounts of these fat-soluble factors in the diet that had vitamin A in that, right? He didn't find a single group that ate the modern-day refined food that was healthy.
That's
Not
right.
one.
And there was a mysterious X factor too,
That's it.
which turned out to be vitamin K, another fat soluble.
Correct. And then Dr. Pottinger in the 1940s did all those experiments on cats. You heard of Pottinger's cats, where he puts them on one group on synthetic food, pasteurized milk and grains, and the other foot he put on raw milk and whole food. And the ones that ate all the synthetic stuff had developed all the chronic degenerative diseases. And for 4 generations or 5 generations of their litter, developed all the chronic degenerative diseases. The other group stayed perfectly healthy generation after generation, as long as they stayed on the natural food diet. And Dr. Price found the same thing, that as long as these native people ate their healthy diet, they stayed perfectly healthy. They had perfect facial structures, no cavities, perfect dental arches, no tuberculosis, no jails, no insanity, no mental disease, none of the hospitals we have. But once they moved away, within a very short time, they lost that protection. So it was not genetic, it was environmental. They had very rich soil and very healthy diets, which were full of these fat-soluble factors like the vitamin A, the copper in the food and in the soil, which we're not getting. So in the protocol that we're working with, we're looking at the whole food complexes that are rich in retinol, rich in magnesium, rich in bioavailable copper, right? So we can get those missing nutrients back into our bodies.
How do we replace copper?
So you're not going to get enough from the food you eat. So there are two things. We have to have enough of that retinol to get the copper loaded into the ceruloplasmin. So the foods that have retinol are ghee, grass-fed butter and ghee, pastured eggs, organ meats, and heavy cream. But we'll usually use a supplement like either cod liver oil or beef liver. Beef liver, as those doctors who won the Nobel Prize can attest, is extremely rich in natural bioavailable copper and retinol. B complex, B12, magnesium. It's like nature's multivitamin, right? So you can either eat beef liver, grass-fed beef liver, once or twice a week, which most people aren't thrilled about, or you can take desiccated beef liver capsules, which we use in a lot of the patients, and our cod liver oil. But there's only a few companies that make cod liver oil that's pure enough to use, right? So you have to get the right supplement too. And then there's coming more and more in the market now, other good forms of copper. Morley Robbins, who developed this whole protocol, has made a supplement called Recuperate, which is for getting more bioavailable copper in the body. We have things like amino acid chelates with copper or copper biglycinate, right? So there, and I think we're going to see more in the next years as people are becoming aware how important copper is, right? But it's really putting it into a whole protocol, not just taking, one thing. You can actually measure these things in the blood, believe it or not. We can measure the ceruloplasmin, we can measure the copper, we can measure the magnesium, the retinol, all the iron parameters, and we can show the person exactly where they're at, not just guessing. And we can watch over time as we treat them how this improves, right? Of course, these aren't tests the regular doctor.
What are natural iron chelators while you're building up your copper? What do you recommend for natural chelators?
Well, I wouldn't recommend the prescription ones right now because they have too many side effects.
Yeah.
They're working on ones that are safer right now. I personally use IP6 Gold, which is a rice bran extract. It's very well researched in therapeutic dosage. It's about 3.2 grams twice a day. It's a wonderful natural iron chelator. And there's curcumin, there's apolactoferrin, some of the bioflavonoids like in green tea.
Yeah,
that'll do it a little bit. I like IP6 Gold the best. That's the best one I've found so far. Right. So if a person's really bad, they probably need to do that, and they need to do the blood donations. Right. You can go donate blood at any blood bank unless you have certain conditions. But for the most part, people can go to a blood bank and donate every 60 days, provided you have the right weight and the right hemoglobin. That's one way of doing it. And you can take these iron chelators too.
And the life expectancy actually increases in people who donate blood.
Totally.
Yeah, heart disease drops, and I believe cancer diminishes.
Well, as I said, iron overload is at the root of all the chronic diseases that people get. So if you get the iron levels down, which is why women live longer than men, they have a period for 40 years, right? There's only two reasons why women live longer than men. One is that they donate blood for 40 years, and the other is they're smarter than us.
So why aren't all these heavy bleeders during perimenopause? They should be getting better.
So what the body's attempting to do, the body's sensing that the woman's going to go into menopause and iron's building up, and it's trying to get rid of some of that extra iron by the heavy bleeding, right? So it's nature's way of attempting, just like hot flashes. When women get hot flashes, what are they doing? They're trying to sweat out some of the iron, right? Because the periods are stopping and now they're getting hot flashes, right? The other issue, though, really with all these perimenopausal and postmenopausal women and in men is estrogen dominance. And why is estrogen rising? That's nature's backup system to low copper. It's antioxidant, and it rises to try to prevent some of the oxidative stress and rusting when copper is not available. But the problem is that iron and estrogen don't react well together. It causes growth of tissue, cancer, polyps, cysts, tumors, fibroids, hyperplasia. All those things are caused by a combination of iron and estrogen, right? Which is what a lot of women are getting as they get into the perimenopausal, menopausal, and men are getting in their prostate. It's filling up with iron and estrogen. right? So if you want to lower estrogen, they need more bioavailable copper and retinol, and you need to lower the iron. The same thing.
So this avalanche of prostate enlargement is really hooked up to iron and
Iron overload.
estrogen.
Iron overload.
Wow.
And copper deficiency causing, not the testosterone. If it was the testosterone, young men would be getting lots of prostate cancer. Right? A lot of doctors make men feel, oh, you can't take testosterone. But all these young men that have 1,000, 1,200, they're not getting prostate cancer. It's not the testosterone. It's the high estrogen, along with the low copper.
Fascinating stuff, Dr. Hotchner. And I want to thank you very much for presenting this information for our listeners. Is there anything that you'd like to leave us with regard to, you have a thriving medical practice, very high-end individuals, people who are very motivated for optimal health. And what have you seen in your practice, maybe 2 or 3 things that you think are going to contribute to increased longevity?
Well, obviously getting on root cause protocol, which people can download for free, by the way, on rcp123.org. There's a 50-page manual that people can download for free that explains all the details of the things to stop, of the things to start. So educating people. We need to educate them as to what is a proper diet, what are the proper supplements to stop, which ones they need to start. And then we need to work on the stress reduction. We're all stressed out, very stressed out. So we emphasize teaching people how to deal with that, from prayer, meditation, spiritual healing. I teach them what they need to do to connect with that place inside themselves that's pure peace, pure love, pure God, which is our reality. If we're not doing that and we're just connected to the outer world, and all day long we're being bombarded by propaganda and all these other beliefs, we're going to feel stressed and anxious. But if our only reality is the one that God created, which it is, and that's pure peace and pure love, then we need to learn how to go into the silence and connect with that and open to that and accept only that as our truth, and stop accepting the beliefs of the world that's trying to tell us who we are. The experts out there don't know. They don't have a clue who we are. And they're filling our minds with garbage, with fear, right? We don't have to accept anything from the world other than that which comes from within, from God. That's the key to healing. To know that you're already whole, you're already one with God, that you were given perfect health, that the rest is just a belief. If the world told you you were sick, you're flawed, you're broken, you're aging, those are universal beliefs. They're not spiritual truths. Only God's truth is truth. Man's belief does not trump what God created, right? So we have to make a choice. Are we going to believe who the world tells us we are and express that? Are we going to know the truth of who we were truly created to be and accept only that and express that? That's the decision. Right? That's what we each have to deal with each day. And that's my emphasis in my practice. I'm teaching everybody how to do that.
And how would someone be able to contact you, Dr. Hotchner, if they have some interest in the work that you're doing?
Well, I have a website, www.drhotchner.com. We have a lot of information. drhotchner.com.
And how's it spelled?
Hotchner.
Okay.
And then I have a healing service. It's free once a month. It's open to anybody, where people can join in through Zoom, Instagram, or come in person. They would have to contact my office to get that information, but they can call the office at 305-856-8185. Now, be aware, we're not taking new patients. The practice has been closed for a while because we're so full. But you can see the website. You can check out the healing service, right? You can certainly read Morley Robbins' book, The Cure for Fatigue by Morley Robbins. Check out his website, rcp123.org. He has many podcasts on his website, many webinars, all of which are for free, right? I've been doing a few podcasts. So if you go on my website, you'll see some of them there. You can check out Dr. Mercola has 2 wonderful interviews with Morley Robbins, right? So the information is out there, right? It's trying to be suppressed. Dr. Mercola's website right now, he's not allowed to keep up the information. You got to go through 'Right? But yeah, the information's there. Right.
Well, God bless you, Dr. Hotchner. Thank you for a really insightful presentation, Kirby. I'm very happy that we had an opportunity to do this. And for the American Academy of Anti-Aging Medicine and Immortality Now, I'm Dr. Ron Klatz, my co-host, Carol Petersen, and wishing all of you a long, healthy, and happy lifespan.
Thank you very much.